Hi, class. This is Dr. Weaver, and I am going to go ahead and record the orientation for the first day for you all. Um, I guess I realized that on the first day, the anxiety levels are pretty high, and sometimes it's just really difficult for you all to really take in what is being said. So I figure if I go ahead and just record the orientation, and hopefully I can make it as brief as possible. And then that way you can listen to it at your own leisure, and especially before the first day of class. And you can always send me your emails, or even on the first day of class, you can go ahead and ask some questions to clear up something that wasn't too clear on this presentation. So there are a number of things that I will go over with you, and hopefully they'll be clear enough. I'm a pretty straightforward, direct kind of person. So hopefully I'll leave very little mystery regarding what is expected of you. So as far as how I prefer to be addressed, you can either call me Professor or Dr. Weaver. I don't go by Mr. Please do not call me Mr. Usually in the classroom, in order to get that point across, I have to stand in a chair because throughout the semester, some like to continue to refer to me as Mr. No Mr. No Mr. So either Professor or Dr. Weaver is fine for me. All of your professors should be addressed as Professor, not Mr. or Mrs. So keep that in mind when you are addressing me, and any of your other professors as well. So let's see. So one of the first things I want to go over with you, and welcome to 1650 Adult Health 2. My apologies. I'm trying to make this as somewhat informal as possible. Yeah. So one of the first things I would like to do, I want to go over the modules in the Canvas tile. You will notice, and I'll show you this because I'm going to be sharing my desktop with you a number of times here. But you will notice in the modules essentially corresponds with your embedded schedule, which is also located in your syllabus. So in other words, week 1, 2, 3, 4, 5, all the way up to week 10, I believe, pretty much corresponds to your embedded schedule. But I will show you specifically what it is I need you to be looking at. I develop quite a few of my, actually I develop all of my PowerPoint presentations, which also contains notes for you to view as well, especially for your testing purposes. So let me go ahead and pull up, I'm going to pull up one of the modules in the Canvas tile, and then that way you'll know specifically what I need you to look at. So let me see if I can share this. Let's see. Yeah, sometimes this can kind of get a little tricky. I think this is the one here. Right. All right. So hopefully you can see this. This is in your Canvas tile. Once you go in under 1650, this is not the cohort tile. We'll be going into that one as well. but yeah, this is actually the Canvas tile that you need to go into. Once you're in the Canvas tile, you can go to modules, and then of course this is the list of modules on this particular page. Let me move this out of the way. All right, so as you scroll down, this is what I need you to see. So just go past your virtual clinical excursions. All right, so this is module / week 1. And some additional information I provided here. I placed here, there's a link for EKG, and this is so that you can look at some of your EKGs, the common ones. And it just provides a lot of information for you to see and consider. Also, I provided a grading calculator. If you click on this one, you can actually enter your grades and more or less keep up with them. Of course, since we're online, it might be a whole lot easier for you to keep up with it anyway. So this might be irrelevant. Now, here is where I have some of my PowerPoint presentations. So for example, if you click on cardiac problems here, and then you click on the cardiac problems link, and here you will find my first presentation, and I hope this is the right one. Down here is where I usually will keep my notes. Let's see, here is the objectives here. And as you just continue to go through the PowerPoint presentation, see here you'll begin to just see my notes that I entered for you. The notes can be a little comprehensive, but if you study the PowerPoint presentations and the notes, you should be quite successful on your exam. So I'm just kind of going through this presentation just to give you an idea of what it looks like. So let me go ahead and come back out of this and go back to modules. Now here's the deal. So as you all realize, I'm sure, this is an accelerated program, and there's a lot of information to actually cover. Some of these topics, these disease processes that you'll be covering are pretty, some of them can be pretty complicated or complex, I should say. And for that reason, I might tend to spend a little more time in class on the more complex topics or disease processes. And that way, if you have any questions, we can just continue to just go through it until you're more clear and comfortable with the information. I say that because right here, hopefully you can see this too, where it says cardiac disorders YouTube videos. Anytime you say YouTube videos, a video, this would be where I actually have recorded, pre-recorded some of the topics that you need to learn and understand. I do this, it is a voiceover. So if I don't get to information in class, then there should be a voiceover, which is the same information. So don't think that you're getting anything different. This goes for each of the modules. So I won't go through all the modules, but you'll see this combination of where it says just study. So these are just your regular PowerPoint presentations. And where it says YouTube video, this is where I have the voiceovers so that you can listen to the lectures. This is especially good for those who are driving from Georgia or some of the other surrounding long distance areas. Of course, you all are virtual now, so I guess that doesn't really matter. If you are at home and maybe you're doing something, maybe laundry, dishes, or whatever the case is, at least you can turn on the voiceover and you can just listen. Or even if you're in traffic and you're driving somewhere, at least it will give you that advantage. But anyway, the whole idea is that you will at least have an opportunity to listen to the lectures, even though it's not uh, being given to you live, if you will. So anyway, if you scroll down to each week, you will see again the regular PowerPoints as well as the voiceovers that I have already pre-recorded. Let's see, so just follow that all the way through. Some of them don't have a voiceover, so it's probably because I was able to get to that information in class. All right, let's see, just want to see what else I need to cover. I'm going to stop sharing for a minute. All right, so those are your modules that I want you to be able to locate and find the voiceovers as well as the PowerPoint presentations with my notes. That's what's really very important for you to be able to see. It will help you with your exams and other assessments, if you will. All right, so trying to keep this in order. All right, so the next thing I'm going to go over is the schedule. There is an embedded schedule that I actually listed on the I think it's module 1, week 1. You can find your schedule. And this information, you'll be able to find the, hold on everyone. My apologies, that was my alarm going off. So I'm going to go ahead and bring up the embedded schedule. So I'll go ahead and share that with you. Just give me a moment. Where are you? All right, so let me see if I can share this one. All right. So there is an embedded schedule located in your syllabus, but I want you to defer to this particular one because what I did, let me increase the size of this. I put the dates here, the week, as well as the dates. Here you will also find all of the topics for the first week that we'll be covering. It'll probably take at least a couple of weeks to cover all of this information. Here also in the first week, there's a syllabus receipt, and I'll show you that information as well. I'm sure you guys have had that information too, so I won't belabor that information either. So if you just keep looking or scrolling down here on this embedded schedule, you'll see your weeks as well as the first day of the week listed here. You see your homework here as well. As you can see, you won't have your first exam until the third week, or the week of the 25th. That will cover chapters 34, 35, and 36. I want you to make sure you are looking at this constantly. Make sure you know what we're covering for each exam or quiz. As I continue to scroll down, so let me go back. So that's exam 1 on the third week. And then on the fourth week, which is the week of June 1st, you have your first quiz, and this covers chapters 39, 40, 67, and 68. Continuing to scroll down the following week, and this is subject to change, of course, but so far this is what I'm looking at. On the fifth week, you have your exam 2, chapter 66, 67, and 72. And of course, the sixth week on June, the week of June 15th, you have quiz 2, which is chapter 62 and 63. I believe I added chapter 25 to this as well, because on your last quiz, there's just too many chapters to cover. So I went ahead and added 25 to this particular one, although I didn't do it here. So I need to go ahead and do that. Forgive me. Actually, I think I can do that now. All right. So this is chapter 25. Chapter 25, which will be added to the immune system. And you'll appreciate this later. It's basically in skin disorders. And so as you continue to scroll down, for the seventh week, we'll be looking at exam 3, and that's chapters 19, 20, 3, 31. I don't know why I have 25 here. I'm pretty sure I moved 25 to the previous week. So I'm going to take that out here. All right. And of course, this is the reason why I had to do that. I went ahead and moved chapter 25 up to one of the other weeks, just so I can kind of balance the chapters that you all have to read. So in week 8, you have quiz 3, and these are all the chapters that you need to look at. Also pay attention to your EAQs here, starting with week 2, I believe. And on the 9th week, we will have the proctored HESI exam. Yeah, so on the 9th week is the proctored HESI midterm exam. And I might even move that as well. I'm not sure. We can discuss that later. And on the 10th week, you will have your final HESI. I say I might go ahead and move rather the midterm HESI, because I have I'll be actually creating the midterm as well as the final. I know we still call it HESI, but it's actually an exam that is created by the instructors until we get back on campus. So anyway, I might move that closer to maybe the 6th week or something, depending on what we have going on. And since we are virtual, I don't have to place these tests, let's say all on Thursday. I can give, not Thursday, Wednesday. Wednesday is your lecture day. I can give you, let's say, your quiz or exam, whatever is due for that particular day. And then I can give you the midterm HESI, let's say on the Thursday or Friday. So we can be pretty flexible with that. So this is what I want you to be able to look at and just keep up with what is going on from one week to another. And I try to adhere to this as much as possible. One of the things I wanted to show you also, let's see if I can bring it up while I'm discussing it. All right, let me, I'm trying to not share. All right, so move that out of the way. So when you were looking at the embedded schedule, typically we have about 13 EAQs altogether. So this term you will have 2 additional EAQs. And before you get a little upset about that, I actually made it a little easier for you guys. So Just bear with me. So let me go here. All right, so for the EAQs, cardiac is a pretty big topic for us to cover. And so I wanted to give you all some more practice, some more familiarity with some of the other topics as it relates to the cardiac system. So I created a homework 1A and 1B. You also have a main homework, which I don't know why that's out of order. You have a main homework 1, that just deals with cardiac problems. I think it's more of heart failure and valvular heart disease. But I also added a homework 1A, which is the cardiac conduction system, and also homework 3, homework 1B. So there's homework 1A, homework 1B, and you have the main homework 1. But the homework 1A and B, it just deals with the cardiac conduction system and also dysrhythmias. That's what it is. Somehow this is out of order, and I don't know why, but I'm going to show this to you. Let me see if I can share again. All right. Be easier for me to show you rather than try to describe it to you. All right. So, all right. Here we have the regular homework 1, which is chapter 35. And then I added homework 1A, which is cardiac conduction system, but you only have 30 questions. You don't have to really level up on this one. And this one will be due on the 19th of May of this month. And then you also have homework 1B. This is out of order for some reason, but this will be due on the 26th. This is a day before your actual first exam, which is on the 27th. And this just covers cardiac rhythms and dysrhythmias, and that's also just 30 questions. So in other words, you don't have to reach proficiency to the extent where you're answering probably 70, 80, 100, maybe even 200 questions. It all depends. You all really should be reading first before you do your EAQs anyway. This would help you to not have to answer so many questions. And I'm sure you all know that by now. All right, so I wanted to explain that to you, that you do have a couple of EAQs to do, but they're only 30 questions apiece for a total of 60 questions. But this should help you with your exam that will take place on the 27th. All right, so I got that out of the way. Let's see, what else? Just trying to make sure I cover everything. All right, so the next thing I wanted you all to look at is the front page of your tile that has a lot of my contact information, and I'll go ahead and share that one as well. All right, so I am your didactic instructor, and Professor Whitten Keller is your clinical instructor. Actually, I'm going to be the clinical instructor for Group B as well. She will be Group A's clinical instructor, and I will be Group B. And this is because of this whole virtual environment situation that we're in. Office location, virtual, as you can see here. So my office hours are Thursdays and Fridays, 11 to about 3 p.m. But you can always text me, call me, email me. My preference is email, but you can also text me as well. Now, the thing about calling me, I wrote here, text before calling, because sometimes, I get a lot of telemarketing type of calls. And it would be appreciated if you send a text before you call me. That way I know who's calling me. Um, let's see, this is my email, of course, and lecture takes place at 10 a.m. To 2:30 p.m. As far as clinical, the clinical starts, the virtual clinical, it starts on the second week of the term. So it won't start the week of the 11th. It should start the week of the 18th. I believe clinical starts from 7 a.m. Through 4 p.m., maybe 4:30 p.m., but around that time. So again, the biggest takeaway here, text me before you call me. Let me know, say, hey, this is student Morales, Miss Morales. Give me, I need to talk to you. And then that way I can respond back to you and tell you to give me a call. If you can do that, that will work out very well for me. All right. Let's see, where are we? So we talked about the front page. I talked about the extra EAQs. As I mentioned to you, they're just 30 questions apiece, and it will help you with your exam and what have you. Also, make sure you pay attention to the HESI case studies, which are still located in the cohort tile as usual. Now, as you all know, our exams will be exams, quizzes, our midterm final. It will be done online. And so let me show you how to get to that. Let me go ahead and share that as well. All right. So your quizzes and exams are under the cohort tile, 1906 cohort tile. If you go under, once you click into the cohort tile, just go ahead and click on quizzes. All right, and once you click on quizzes, these are not seen. You cannot see this now because I have not published them. So this is quiz 1, then there's a quiz 2, there's a quiz 3. You also have exam 1, 2, and 3. You have the midterm as well as the final here as well. So this is how you will get to your exams and quizzes. The exams and quizzes are timed. I do give you maybe 12 hours, maybe 18 hours or so, a window to take the exam because I know your schedules vary widely. But there will also be times where your quizzes or exams will be given to you during class time, which is on Wednesdays. Actually, to be honest, since you all are at home, my preference, and you all let me know how you feel about this, but my preference is that you will, let's say we have to be in class at 10 o'clock, that you go ahead and start taking your exams at 9 o'clock, 8 o'clock, 9 o'clock. And that way we don't have to go into our lecture time or our class activity times taking tests. I think this would be much better because as I mentioned, there's a lot of complex topics to go over, and I really like to spend my time with it, especially in the pathophysiology of each disease process. And so you would certainly appreciate us having the time to do that. All right, so I'm going to back over here. All right, let me look at my list again. Also, I wanted to stress to you all, my main method of communication is by way of email. So I really do need you to look at those emails. Also, I do put information in the announcement section as well. So make sure you're looking at the announcements too. Very important. It's our primary method of communication. Let's see, I told you who your clinical instructors would be. I'm with Group B. Professor Wittenkeller is with Group A. That is on Mondays and Tuesdays, starting with the second week. I hate to ask you all this because I know money can be a little tight for many of us. But I hope that you all have a printer. And I also hate to tell you that printers are pretty cheap. They are cheap, inexpensive. What's expensive is the ink, and I'm sure you all know that. The reason I bring that up is because there will be forms at times that I have to send to you all to fill out, and you have to actually print them, fill them out. Even if you can fill them out online, you still have to print them to sign them. And as far as a scanner, I'm sure you all know that you can download the scanner app for your telephone and make sure that you can use that scan app to scan the document and then upload it and email it back to me. So that's why having a printer and having the scan app on your phone is so important. So if y'all can kind of work on that, if possible. Otherwise, you'll have to depend on someone to print something for you, maybe at their job or wherever. And then, of course, you have to, go through all that inconvenience, if you will. All right. And so I think one of the last things I wanted to cover, we will be recording the lectures. We will be recording the lectures on Wednesdays. And I will place that recording under the HESI cohort tile under modules. And it will be entitled 1650 Recordings. And I'll try to title it and also provide the dates, and that way you know which one to click on, just in case. And this is especially important if someone has to miss not clinical, but the lecture for whatever reason. I would like to, during some of the lectures, provide you guys with a variety of learning activities. Lectures will be the primary method of getting information out because it is faster. But those of you who just don't want to hear me talk, which is fine with me, I can provide you with concept maps. We will be doing concept maps in my clinical classes. However, even in doing the lectures, if you wanted to sign off and just work on a concept map, and I'll give you the disease processes that you need to go over. I cannot think of much of anything else. The class would be somewhat informal. Actually, there is something else. Let me make sure. Talked about that. Let's see, what is this? Oh yeah, let me show you this. So I told you about the recordings. This is the HESI cohort tile under, well, let's see. This one is actually not on the modules. So once you click into the, let me go back out, just to make sure. So once you go into the HESI cohort tile, all right, without clicking into anything, just go ahead and scroll down all the way. And here's where the 1650 recordings would be. Just want you to see that. All right, so I'll try to place all of our recordings in this particular section. That way you can go back and listen to it. I would like for you to listen to this lecture. Well, it's not really a lecture, but this presentation, this orientation before class. And again, that way we don't have to spend any time dealing with a lot of this. Something else I need you to see. Where is it? maybe it's here. All right. So all right. So there's a few forms that I'm going to have to get back from you. And this is why I say you would need a printer and of course downloading the scan, the app scan. So as far as some of the documents I've already sent you, let me go ahead and share that one as well. Am I sharing? Oh, all right. So these are the classroom behavioral expectations. I would like for you to read this information. You guys can read. You're in an RN program, so I know you can read. So take a look at that. Yeah. So take a look at this information. I want you to print this document, print your name, give me your signature, and also date it, and get that back to me. This is a copy of the concept map here, and I did fill out some information just to let you all see what it more or less looks like. One of the things I didn't do when I sent this to you, you see up here where it talks about the labs, the BMP, as well as your CBC and so forth. Well, this N here means normal. But let's say, for example, if we're talking about the white blood cell count, I believe it goes here. So if the white blood count on a patient who has an infection, let's say it's 20K, there are actually arrows here that goes up, down, meaning high, low, or normal. So you'll be doing a lot of that as well. We'll go over some of the concept maps in class the first time because I want you all to be able to see what it is I'm looking for. Here we talk about the medications. I want you to not only list the relevant medications for a disease process, but also the mechanism of action for that particular drug. What is that drug doing? And of course, all the other information here. This is also important, assessment data. I typically like to break down my signs and symptoms by systems. So if I'm dealing with, let's say, congestive heart failure or heart failure, we're looking at what's happening to the patient neurologically, pulmonary-wise, GI-wise, renal, skin. So I like to break it down like that, and that will help you to remember your signs and symptoms a whole lot easier. Also of note, on your concept maps, and you all can work in groups, but on your concept maps, you have to continue to save as you enter data. If you don't, it won't save it. And actually, once you put all that information in, it will be blank. So make sure you keep saving, not to PDF yet, but just keep saving. I don't see it here now on this page, but there's a function up here at the top that talks about saving your file. So just keep saving as you enter the data. Let's see, and of course, I told you this already. You guys need to know the normal blood flow of the heart. Please do not come to my class without knowing this chart. If you don't read anything else, you need to read this chart. This is basic. This is an anatomy and physiology. Each time we go over a disease process, whether it be renal, whether it be pulmonary, whether it be cardiac, you guys need to do a quick review of your anatomy and physiology. That way you'll know the normal. How do you know the abnormal if you don't know the normal? If you know the normal, if anything deviates from that, then you know something is wrong with your patient. For example, you know the normal respiratory rate is between 12 and 20, and you look at a patient and their respiratory rate is 30, well, you know that something's wrong, right? You know if a normal blood pressure is 110/70, and this patient has a blood pressure of 180/120, you know something is wrong. So know your normal, so you know the abnormal when it deviates. This is my student expectation. I want you to go ahead and read this information as well. And then there is a signature page I want you to print your name, your signature, and also the date that you sign it. This is, let's see, this is your syllabus. You can go through this as well. If you have any questions, of course, this is what you're being evaluated on. You have exams, quizzes, assignments. Make sure you're doing your homework. Let me tell you something. There are times when someone, all they needed was 1 point. And if they had done their EAQs and other homeworks, it would have pushed them over the passing a minimum grade. So please don't get caught, you know, in a situation where you don't pass the class because you didn't do everything you're supposed to do. And this will also help you to pass your NCLEX. So don't slack when it comes to this. You see where it says the final HESI is worth 40%. That's pretty high. So you have to make sure you have to make sure that you're well prepared for that. And also with remediation, you have to get a minimum of 78%. For your final remediation, I typically give a pharmacology, a med-surg pharmacology exam, EAQ exam. So I like to do that because I don't get to cover a lot of drugs during the disease processes that we go over, or the exams that I provided. That may change, but I still would like to give you all a pharmacology remediation. So I'm trying to use as much of my time as possible with you all to give you what you need. And just continue to scroll down. Again, this is your syllabus. Look at the letter grade percentage ranges. This is that embedded schedule that I was telling you about, but look at the one that I posted under week 1, module 1, because that has the dates, the date of each week when things are due, so that it'll be easier for you to follow. And at the end here, you have the student name. I want you to print, sign, and of course, you can put my name here. And this last page, I need you to print it and send this back to me as well. And of course, this is that embedded schedule that I sent you already and that we've already gone over. I don't want people coming to me and saying, what is the first exam chapters? I don't want you to ask me that question when you have the information right here. So I want you guys to be as independent as possible. So this will give me more time to give you what you need instead of continuing to go over a thing, you know, when it's not necessary. So I think that's about it. I think that's about it as far as those attachments I sent you. All right, so let me look at my sheet again. We are at 44 minutes now. Believe me, this would have probably taken 2 or 3 hours in class. So even if you have to listen to, same with lectures, if you have to listen, if a lecture is an hour, they're usually shorter than that, but there are some that might be an hour. But if you listen to, if a lecture is an hour, listen to the voiceover maybe for 30 minutes, put it down, go somewhere, do something, you know, wash some clothes, cook a meal or whatever you need to do. And then come back and just listen to the rest of it. In other words, you don't have to sit there in one setting. The same thing with your reading. You don't have to sit there in one setting when you're reading. If you're reading, let's say the chapter on cardiac, especially on heart failure, it's a long chapter, read so much, walk away from it. It clears your mind, it helps you to think better when you come back and have to do it again. But doing your EAQs, reading the material, reading my lectures, the PowerPoint lectures, as well as the voiceovers, and doing your HESI exams. If you do these things, you will be successful in this program, in this class. I don't think I had one failure last term, and believe me, I tested them at a pretty high level. I I think that is about it. Whatever I forgot to cover in this brief presentation, um, I will go over it later on. But for the most part, I think I got out of the things to you that you will need. I cannot think of anything else. So I'm going to send this out to you all. This is your rest week, week, so to speak, a week for you to rest, you know, depending on how you look at it. But I would go ahead and listen to the lecture. I think the first day of class is for you all on Wednesday. So, but if you can listen to this before that time, this will be out of the way and we can just move on and get straight into the lesson itself. And I do appreciate you all attending my course. I am pretty detailed. I will tell you that I do believe in pathophysiology. Once you know pathophysiology, then everything else falls into place. When you know your pathophysiology, which is the abnormal part of that disease, then you know what your signs and symptoms will potentially be, your interventions, your treatments, and so forth. So you really need to understand the disease process itself. And we'll go over that. And I do spend quite a bit of time on the pathophysiology of each disease process. So, but we'll be fine. I want you all to keep an open mind. Those of you who I know begrudge coming or having classes online, get used to it because, and I'm not saying that in a mean way, but honestly, when you all pursue the completion of your undergrad, and then of course you pursue your graduate degree, whether it be your master's or your doctorate, it will be online more than likely, so at least you're kind of getting some exposure to that now. So my apologies, I didn't do an introduction about myself, but I'll do that in class. Just wanted you to get as much of this information as possible. And I think that's about it. And I will see you guys on next Wednesday, which is the 13th at 10 o'clock, I think. Thank you.